Thank you for joining us.
Hey, thank you for having me.
I think, first of all, you've got a visual aid to show us. What have you got for us there, doctor?
Well, one of my best nurses, Miss Yolanda, the elf, she provided me with this post that she found on Facebook today. And it's an acronym, and it's the new normal protocol. Avoid touching men. And when that says men, it's talking about when you go out traveling and you're in the airports or the bus stations or even at the gas stations, it's advised to stay home as much as possible. But if you do have to go out, avoid touching men. And that's the acronym for don't touch your mouth, don't touch your eyes, and don't touch your nose, because these are high probability of transmission, because you can touch a gas handle and it might be touched by someone who had coronavirus, and then you touch your mouth or your nose, then you can give it to yourself. So avoid touching men, your mouth, eyes, or nose, but instead follow women. And that means wash your hands, obey social distancing, mask up, exercise and eat well, and no unnecessary traveling. So this is a really cool acronym, and it's following all the guidelines that are recommended by the CDC and all of our healthcare officials.
That would work. We'll have to get that posted somewhere. Share your friend's Facebook page. That would be the thing to do. We're talking about traveling. Could flying or driving increase the risk of contracting the coronavirus?
Most definitely. I mean, the CDC and all our healthcare officials, they're advising to avoid unnecessary travel as much as possible. And other alternatives, such as maybe doing Zoom with your family, like we talked about for Thanksgiving. And just understand, with this vaccine coming out, next year will be better. So we just have to be patient and understand that it will get better. But this year, we really need to follow these precautions as much as possible.
How about quarantining when you get where you're going? Is there a necessity for that? Is that a good idea? Or would that take up your whole weekend?
I mean, that is a good idea if you can, as much as you possibly can, because you have to think, traditionally during Christmas, Thanksgiving, the holidays, we go visit family. And a lot of times these are elderly family members, like our grandmother or our uncle. And in a lot of cases, they may have compromised immune systems just based on their age. And then in a lot of cases, they'll have chronic medical conditions as well, such as kidney disease, diabetes, hypertension. And all of this can make that person more vulnerable. So we need to take all this into account. And we don't want to give anybody the Christmas present of the coronavirus. And just be patient and know that next year, things will be better.
Great. Well, Dr. Quinn, we're going to see you again at 4 this afternoon with more information. Love the hat, by the way. Merry Christmas. Thank you for dropping by.
Yes, sir.
Hey.